people in your neighborhood? In your neighborhood. In your neighborhood. Oh, who are the people in your neighborhood? They're the people that you meet when you're walking down the street. They're the people that you meet each day. Hey girls, welcome back to Mixed Story Time. Remember, we've been talking about people in the community that help us out, right? Now, who do you think I am today? I'll give you a clue. It's somebody that helps us out when we're sick or hurt. That's right. Today I'm a doctor, Dr. McMahon. All right. So we're talking about our doctors. And remember the tools or the different things that a doctor might use, right? I'll show you some of these pictures here. Do you remember some of these things that a doctor might use? Okay. Down here, a doctor might what? Take your temperature, right? If you're not feeling good, you're feeling a little warm. All right, this is something that takes your blood pressure, right? And this is sometimes if you need a shot, right? There's a syringe to give you a shot. That might not be so much fun, but there's some other things that a doctor might use. Oh, one of these. Do you remember what that's called? You're right, it's a stethoscope. And he puts it in his ears and around his neck and puts the bottom part on your heart to hear your heartbeat, right? And there's an otoscope. Okay, if your ear's not feeling so good, it's something that he uses to look in, he or she looks into your ears. All right, and here is a reflex hammer. Okay, check your reflexes. Okay, make sure you've got healthy knees and reflexes. All right, now there's some other things if you noticed. What else? What do I have on my face? Yeah, you might see sometimes doctors will wear masks, right? And a little doctor hat. What am I wearing on my hands to keep them protected? Yeah, doctors wear doctor's gloves too. All right, doctors need lots of different tools and things to help you feel better. All right, so today's story I have, it's called I Want to Be a Doctor. Maybe someday you will be a doctor too. And it's by Laura Driscoll, illustrated by Catalina Echeverry. That's a very fancy name. All right. Now let's see what happens to this little girl's brother when they go to the doctors. We are at the hospital. My mom and dad, my brother, Jack, and me. Jack is not so happy. His foot hurts a lot, okay? They had to go to the hospital because his foot was hurting. I saw the whole thing. Jack flew off his top bunk. Maybe he forgot that he can't fly. Dad put ice on Jack's foot. His foot is black and blue. Mom thinks it could be broken. Uh-oh, girls, look at this. Jack tried to jump off the top of his bunk bed. Not a good idea. Not a good choice. Danger, danger, because he hurt his foot. And so now they have to go to the hospital to see if a bone is broken in his foot. A big owie. Eey. So here we are in the emergency room. It's a very busy place. Look at all the people waiting. Some people are hurt and some people are sick. It's a good thing that doctors are here to help, right? We don't know what to do without those doctors to help. I like to help people too, I tell the doctor. Her name is Dr. Tate. Maybe you will be a doctor someday, she says. All right, Dr. Tate's there to help. Dr. Tate looks at Jack's foot. She touches it gently. Let's take an x-ray, she says. It will show us if any bones are broken. All right, an x-ray, right, is when they take a picture of your bones. We go to another part of the hospital. An x-ray machine takes a picture of Jack's foot. All right, it's a big machine. But if you don't feel anything, they just take a picture of the bones inside. A man comes to look at the x-ray. Are you a doctor too, she asks. Or I ask. Yes, he says. I am Dr. Dean. I read the x-rays. So a different doctor reads the x-rays to check it out. the doctor does see a tiny small break in one of Jax's bones. So next we go see Dr. Jones. He's the bone doctor. There are doctors just for bones, I asked. Wow, so many doctors. Yes, Dr. Jones says, just like there are heart doctors, brain doctors, and skin doctors. There's doctors for everything. Who did you see to get those glasses? Dr. Jones asks. The eye doctor, I say. What do you call your tooth doctor? Dr. Jones asks. The dentist, I say. And who do you see for checkups, he asks. My regular doctor, I say. Oh, I get it. She's a kid doctor. Mom and Jack go into the exam room. Dad and I decide to get a snack. In the cafeteria, we see lots of doctors and nurses on their lunch breaks. Dr. Tate is one of them. Okay, doctors need breaks too, right? I used to think there was only one kind of doctor, I tell Dr. Tate, but there are so many kinds, right? What kind would you be, Dr. Tate asks. I shrug. Well, would you like to meet a few more, she asks. Great idea. Dr. Tate takes us around the hospital. We meet Dr. Lou, who's a baby doctor. I've always loved working with little ones, Dr. Lou says. Then we meet Dr. Kent. He helps people walk again after an injury. I really get to know the people I treat, Dr. Kent says. Some of them I see every day. Okay, he helps the people that have had an injury to help make their muscles back strong again. Right, physical therapist. We meet Dr. Lopez, who works in a lab. She does tests to see what is making someone sick. You must like puzzles, I say. Yes, Dr. Lopez says, our work is like solving mysteries, right? She works in a lab, figure out what is making people sick. I asked Dr. Tate what she likes about being an emergency room doctor. Well, I meet so many people, she says. Every day is different and busy, right? Later, we go find Mom and Jack. Jack has on a special boot. He needs to wear it for a few weeks. It will help his bone heal. Jack can even walk with it. He is feeling so much better. All thanks to all the doctors, right? All right, girls, I bet you didn't realize, girls, that there are so many different kinds of doctors, right? Let's talk about some of them that were in the story, okay? Do you remember the emergency room doctor, right? Dr. Tate? That's the doctor who works in the emergency room in the hospital, okay? Now, do you remember the doctor that read the x-rays? He's called a radiologist. That's a big word. And remember the doctor that helps fix the bones? He's an orthopedist, okay? Remember she met the doctor that takes care of the babies? Neonatologist, right? And remember the doctor who helps patients do exercises so they can heal and move better after they've hurt themselves? That's the physical therapist. And a doctor who does the tests in the laboratory to figure out what's making someone sick. Remember, that's the pathologist. And the doctor who takes care of teeth is our what? Dentist, right? And the eye doctor is called an ophthalmologist. That's a big word. And the doctor for children is called a pediatrician. So many doctors, right? If you were to become a doctor, which doctor would you become, right? That would be a great thing to become a doctor. Now, oh my goodness, Dr. McMahon is on call. Dr. McMahon is on call. Girls, I might have a patient today. A patient who isn't feeling well. I wonder who could it be? Maybe I need to use some of my tools to help him out. Who is it? Oh, it's Curious George. Oh, hi, Curious George. Oh, poor Curious George. He's not feeling good today. We might need to check him out. All right, I'm going to lay him down. All right, Curious. Let's see. Now, good thing I have my doctor's kit here with me today. Woo! I'm going to check him out to see what might be bothering him. Let's see what I've got. Do you remember? First thing I might need to do is use this. Do you remember what this was called? To help to listen to his heartbeat to make sure everything's working. All right, I'm going to put it on, and it's the stethoscope, right? I'm going to listen to Curious's heartbeat. Ready? Oh, I'm going to put it on his chest to listen. Oh, the thump, the thump. It's sounding good. Curious George, you've got a good heartbeat. All right, let's see what else I've got to check him out. Let's see. Oh, maybe I've got to check his temperature. Maybe he's running low. I got my thermometer. I'm going to put it in his mouth, right? All right, Curious. Let's see what your temperature is. Oh, let me see. Let me check it out. Girls, it's looking a little high. Oh, no, he has a temperature. Let's see. Oh, remember this? Let me check his ears out. Maybe he has a little owie in his ear. Let's check. I'm going to check his ear. Look inside his ear. Oh, he might have a little owie in his ear. Let's see. You think he needs a shot? Do you think we need to give Curious a shot? I don't think he needs a shot for that. Maybe he needs some of this. Ooh, I got some eardrops for Curious George. Maybe that'll be helpful. Do you think I should give him some eardrops? Okay, we'll give him some eardrops to help him feel better. All right, Curious George. All right, all better. I think you're gonna be all better. All right, girls. All right, don't forget, there are many different kinds of doctors you could be. All right, which doctor would you be? Bye-bye.